Welcome back to Quick Hits. I'm your host, Tyler Smith. Today's guest has seen healthcare from just about every angle possible. As a physician, a policymaker, a CEO, and board leader. Dr. Bill Winkenwerder is currently the chairman of CitiusTech, HCM's parent company. His career spans decades, from medical training and research to serving as Assistant Secretary of Defense for Health Affairs. Additionally, Bill held leadership roles at Kaiser Permanente and Emory University before leading Highmark Health as president and CEO. In this episode, we get into the biggest challenges health systems face as they modernize: legacy infrastructure, consolidation pressures, and the constant pace of change. We talk about why getting your data right isn't just an IT project. It's the foundation for everything that comes next, including AI. Bill also shares his take on where agentic AI will have the most real-world impact in the next 3 to 5 years, and why the human element in healthcare isn't going anywhere, no matter how smart the technology gets. And we close on something that clearly drives Bill at his core: a future where everyday people are more educated, more empowered, and living healthier lives. This is a conversation with someone who has shaped healthcare policy and technology at the highest levels, and still believes the best is ahead of us. Let's jump in. Welcome back to another episode of Quick Hits. I'm your host, Tyler Smith, CEO of Health Data Movers, and I'm pleased to be joined by Dr. Bill Winkenwerder, who is the chairman of CitiusTech. Bill, how are you doing today?
I'm doing great. How about you?
Can't complain. Excited to be chatting with you in a more formal venue, if you will. And I know Tatum, who's walking back and forth behind me, is very excited as well. So let's start it off. To kick things off, if you don't mind walking us through your career journey, how you started, as far back as you want to go, and then how you ultimately ended up as the chair of CitiusTech.
Yeah, happy to do that. There's a lot there. I'll just start by saying that I was originally focused on becoming a practicing physician, but what grabbed me was my own curiosity and passion to make a difference that went beyond individual, doctor-patient relationship, which I always enjoyed a lot. But as I got into the years of my training, I saw things going on with the healthcare system more broadly that told me that there were big problems in the healthcare system, and I just didn't know who was who was working on that, who was going to be in a position to do anything about all that. And so I decided early on that I would maybe get some additional training outside of medicine, which was to go to business school, do a fellowship, learn about research, data, that kind of thing, and just kind of open the lens. And that really set me off on a very different career. And it's been a real journey. So I can talk more about that, but that's how I got started. And in particular, in the world of information technology, early on, it was clear to me that one of the big roadblocks to better patient care and to better inform patients was having better data, better information to support decision making. And so that it made a lot of sense to me. And that caused me to want to learn more about those types of issues.
Was there a particular instance or example story where it really clicked? I'm sure there are tons, but maybe there's some that stick in your head about when you realize the importance of data.
Yeah. Well, I would say it was as far back, believe it or not, as the late 1980s. That was a time period, hard to really imagine it now, but it was a time period in which there were no such things as mobile devices, no such things as laptops or even desktop computers. Basically, all we had to work with were mainframe computers that were fed with programs to do large jobs. And so it was very constrained by that. But you could see, because that was the early days of Apple and Microsoft, you could see that there was going to be a lot more technology coming on board.
Sure.
And before long, everybody did have the capability, at least for a desktop,
Right.
by the mid 90s, and the internet came in. And then in the early 2000s, in about 2005, 6, 7, we began to have, computing power uh, cemented together with telephones, with
Right.
mobile phones. And then that changed everything. So that's a quick version of the last 40 years of IT and healthcare, but
Sure.
it's been quite a ride. Yeah,
Yeah, obviously I can't speak back to some of those years
yeah,
but I do remember the time period, when I got in, it was the 2010s. And so
yeah,
it was like getting some legacy um, mindset around not moving to paper, and that was like the
yeah,
hurdle we encountered there, not encouraged. Um, but yeah, so I mean, there's been these different paradigm shifts right now. From your vantage point, what are the biggest challenges health systems are facing as they try to modernize their technology and data infrastructure?
yeah. Great question. There's a lot going on. There are a lot of pieces and parts to the answer to that question. First of all, healthcare systems obviously deal with a lot of regulation, a lot of expectations, a lot of requirements for privacy, security, and just non-fault tolerant systems. So that's one aspect of things to deal with. Then there are legacy systems that are old and built on old architecture and old infrastructure, and to replace those at the same time you're building new things is no easy task.
Sure.
And then the new stuff just keeps on happening. So, you know, what I just told you might take things up pretty well till like 5 years ago. But
Sure.
then with the introduction of AI and agentic AI, it's a whole new game again.
Yeah.
So it seems like every 10 to 12 years, roughly, maybe 10 to 15 years, there's something new and really big that happens that
Sure.
changes things. And so that's all going on. And then on the economic side, there is sort of, it seems, an inexorable um, set of forces that has caused a lot of consolidation among health plans, consolidation among large healthcare delivery systems,
Sure.
and even now consolidation among technology providers. So uh, that plays out, and it tends to go for quite a while with everybody within a particular subset getting bigger and bigger. And then something happens that causes that to break down and splinter apart. And, it's kind of this constant churning and turning of things. So, an example would be in the area of pharmacy.
Yep.
Pharmacy benefit managers was the idea of that was just totally new, uh, 25 to 30 years ago. And
Sure.
then within a short period of time, that all got overtaken with the emergence of, roughly a half a dozen or so pharmacy benefit managers, and they took over the responsibility of pharmacy from
Right.
the health plans. And then now they're under attack by the
Right.
government and under tremendous pressure. And if you were to ask me, I'd probably say they'll be disrupted and pulled apart, taken apart, whatever, something along those lines. So that's kind of a little mini picture of the constant change that has been happening.
So using PBMs maybe as a jumping off point, and you mentioned like the consolidation, the oversight. It's yeah, as you pointed out, it's across the healthcare landscape, whether we're talking about IDNs, or even smaller practices. But we play more in that latter space. So what
Yeah.
advice do you give to leaders that are navigating complex systems integrations and EHR consolidations?
Yeah. Well, first of all, you have to tend to the core business, your core business. You have to make money.
Right,
So if you're not making money, you have no money to invest.
right,
So the first thing you must do is, sort of no money, no mission. You've got to make sure that you can sustainably invest in something, whatever that is, over a period of several years. And you
sure,
have to have the institutional organizational commitment to that direction. And that's really easier said than done. I mean, there are just many, many ongoing examples of organizations that sort of take a tack down a road and think they really need to do something. They do get down the path a bit, and then they realize that either it's not working or it's not producing what they thought it would be, and they have to just retrace and throw it all away. You
right,
know, so you don't want to do that, and so that means scoping out bigger projects with clear ideas about the goals you have in mind
yep.
and being committed to those. And your board and governance needs to be committed as well.
What are ways that you find that you're able to get the buy-in from the board and create those clear objectives in the midst of rapid change and consolidation? Obviously, there's two or more groups coming together. There's
Yeah.
a lot to compete. Yeah, would love to know or hear how you've helped groups or been part of the groups that have navigated that successfully.
Yeah. I think that, first of all, you got to have a good board. You got to
Hmm.
have people that know how to think and that think long range and that, know how to provide the oversight so that management can benefit from that and can take
Sure,
steps that they need to take. Um, and then that board needs to ask a lot of questions and
sure,
sort of insist that the management put together plans that they can review and evaluate and give feedback on them. And then, typically it's always going to require some kind of commitment of capital.
sure,
And you have to, size that up and determine if that's something you can do or not. I will say that, organizations that just kind of refuse to even engage in all of what I've just described, over time, they put themselves at real risk. Because
right,
if you're not, you know, seeing the future, investing in the future, and building for the future, you may do okay for a few years, 3 years, 5 years, maybe 10 years, but at some point you're so far behind that you don't have any chance to build what you need to build for your future, and you become beholden to other forces.
sure.
You've probably seen that with what you've done with health data movers and the client base.
No, 100%. And one of the areas we focus on a lot is the data management piece, and so you know,
Yeah,
yeah, we talk about data migration as the foundation for innovation. Uh, as these organizations come together. So, but would love to hear your take on why getting the data right is so critical
yeah,
before organizations can complete consolidation, but also realize AI and advanced analytics.
yeah. Well, you can't do AI without good data, great data, clean data, continuously clean data, and so creating that is no easy task. And again, an infrastructure needs to be in place to do that. Ideally, you're operating in a cloud-based environment, and you have developed the ability to extract and clean and then be in a position to use data from various systems. and then AI can be applied over, and with all of that together. But the data is the foundational block, really. Without it,
Right.
you can't do much. And so I think it's taken a little bit of time for people to realize that
Sure.
it's easy to talk about,
Right.
but really doing it is not so easy. And you look inside a typical, even let's say a large academic health system, academics health based health system,
Sure.
and they're just probably dozens of different data sources,
Right.
and they were built for different reasons, and being able to extract information cleanly, effectively, efficiently from all of those, and then be able to apply AI is that's a big task. And it's not done in a short period of time. You have to kind of build the ship, so to speak.
Yeah. 100%. And in that shipbuilding analogy, HDM now is part of the CitiusTech ship, or
Yeah.
I don't know, how we like. I guess our tender is now on board of the super yacht. How do you see organizations like CitiusTech and Health Data Movers evolving in this next phase of healthcare?
Yeah, great. Again, great question. We think about it all the time. Um, CitiusTech's history is in software engineering. And so a real plus for us is we understand data and we understand building things. We understand engineering. We understand healthcare. We understand healthcare processes and business processes. And so that's a tremendous, advantage and starting step. On the other hand, we didn't build the LLM models and the AI tools, and those are to be and will be and are being used by us internally, but they're
Right.
obviously also being used by our customers. And our customers may want to themselves deploy some of those AI tools, but at the same time, we're finding that they want to work with another party who can help them do that, who
Sure.
really spends all their time in this world and has been doing it and has a lot of credibility. Uh, and so it's really it's more of a partnership model. I think
Right.
that's one of the things that's changing the world for us is we're getting more and more done by partnering, not just with our customers and clients, but also with other players,
Right.
players that are the big hyperscalers or players that are in the world of data,
Right.
like Snowflake or Databricks or those kinds of companies.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show. And when you're looking at evaluating those partners like the Snowflakes or the hyperscalers, how do you think about the engagement? How much, you mentioned putting resources behind big changes during consolidation. Obviously, like partnerships can involve time and money, and
Yeah,
would love to hear how you think through which partnerships to pursue and how much effort.
right. Well, you're making, or we are making, other companies like us are making judgments
Right.
about which partners are the best partners to work with. They're doing the same thing. We hope they like us. We hope we like them. that kind of thing. But we
Yeah.
like each other because of the talent, the skill, the organization, the commitment, the track record, all of those things. And so that it feels like a really good match, a good pairing. And that's what we like to do. We've been, I'd say, fortunate, but also I wouldn't just attribute it to good fortune. I think there's been a thoughtful, determined effort to build, strong partnerships with those very large and important companies, and to work together with certain of their leaders, such that they know us and they have high regard for CitiusTech and our teams, and that's a great position to be in. That wasn't kind of who the CitiusTech was, let's say 10, 11 years ago when I joined the board, but
Yep.
that's evolved, especially so in the last 5 years.
Yeah. And I mean, not to pump you up too much, but we were a bootstrapped enterprise until we joined up with you all, and we
Yeah,
had additions in the hyperscaler space. And it's not easy to become just a partner,
right,
as we learned. And once we came under the umbrella, it's incredible the respect and relationship you all have, and how much faster we've been able to move. And then for us, it's just a matter of like, how much time do we have to work on certain initiatives, which is a
right,
very high quality problem.
absolutely.
So, we've talked about AI, especially about the data in has to be excellent for the output to be effective. It's top of mind for every healthcare leader. But what do you see as the most? And I know I'm putting you in a crystal ball situation,
Yeah,
so maybe we'll
all
listen to
right.
this in 2 to 5 years. But yeah, where do you see the most meaningful real world impact of AI in the next
Yeah,
3 to 5 years?
yeah. Well, I think about that a lot, and my take on that question. It's a great question, but it's in the business processes that constitute, what happens inside a hospital, uh, inside the pharmacy value chain, or inside a clinical practice where care is being delivered by a group of doctors and nurses. So all of those organizations have, as you know, business, they have processes for doing things. And in healthcare, for various reasons, we're a people intensive set of businesses.
Right.
And where I see the great potential value of agentic AI in particular, but applying AI, is making or creating processes that are more efficient
Got it.
and more effective, just better in terms of outcome and result, and doing it with fewer people.
Sure.
And net that should help uh, reduce the cost of care.
Sure.
I've been through enough. I'll say with that said, I've been through enough changes over the last 30, 40 years
Yep.
that there's typically, again, in a roughly 10-year cycle, a promise of something that's going to happen that's just going to save healthcare,
Right.
and that just doesn't happen.
Sure.
But what does happen is that things can and do get better in an area. And AI could be, who knows? It could be a little bit different, but you're always going to need human expertise
Sure.
uh, to design things, to um, interact with other humans in ways that they trust,
Sure.
and so healthcare is not always a life and death thing, but it is at many times. And so I have a hard time seeing a world where a person would really prefer a robot to a person,
Right.
to be with them as they're trying to deal with their life. So, but that doesn't mean that there's a lot of automated capabilities that can't be, all around the caregivers,
Right.
the people that are designing things. And hopefully that's what can happen, and that it will be done in a way that creates more, again, effectiveness, efficiency, and precision.
So, as you describe this future, I'm picking up language around the clinical side. And from some conversations I've had with folks smarter than me, obviously more on your level, there's been this notion that we're actually getting much more traction from AI on the clinical side than on the business side, which
Yeah,
one would think would be the inverse because,
right.
and yeah, would love to hear your opinions on that and the
Yeah.
why.
Well, I think the need is there in both areas, uh, but I think that the physicians, for example, that are caring for patients for the last 15 to 20 years have had to uh, labor under, if I can use that terminology a bit, the requirements for documentation.
Sure.
And and it's not just them, it's everybody. It's got to document it. And we
Right.
do that because we want care to be better. We want a record. We want to
Right.
know what happened, when we learn from the data. It creates a framework for constant learning, which is good. On the other hand, it takes a lot of time,
Right.
and all of that, or much of it, can be automated, and then you can get better information and then apply your judgment to the person or persons that you're trying to help. So I think that's what I see as a real opportunity for us going forward.
Yeah, it's certainly a very promising future. I also think to like outside of the US where you have these countries where they don't even have we have a physician shortage, a clinician shortage, but then
Right,
there's countries that don't even have physicians
right,
in specialties, and it's like if we could extend the productivity across not just state lines but like country lines, what might happen to the world healthcare. It's a very like idealistic but hopefully realizable future.
yeah. Well, exactly. And given some of my earlier experiences, especially at the Department of Defense, working with countries, for example, in Africa or the Middle East, even places like Afghanistan, who had very little infrastructure, you'd be surprised at how much they could get done with
Sure.
with their systems, and just a little bit more help and support. They could do a lot more, and it's like with a version of something that doesn't have every single bell and whistle, but has enough to make it work.
Sure.
Uh, that's something that can really help in a lot of different places. There's one other area I wanted to touch on, and that is just the impact on individuals, you
Sure.
know, patients, individuals, consumer, whatever people want to call the individual. But I think that uh, my greatest hope for the future is that people will be more educated, especially youth, and even through life, to consume health information and to make better decisions for themselves and for
Sure.
their health. So much of our cost of healthcare today is self-induced or self-generated, for habits,
Right.
and that end up producing a very unhealthy person. And a lot of times, probably the majority of the time, still you see people who have no clue of the relationship between what they eat, how much sleep they get, all
Right.
these things that directly impact your health. They don't know that that's the case, and they do things, and then they don't understand why they're sick. So that's not where we want to be. We shouldn't have
Right.
to be there.
Right. Because right now the information is at everyone's it's been at everyone's fingertips, but through these platforms, your AI of choice, you can almost have a conversation with um, essentially a provider or, whatever the
Yes,
technology is licensed for. So.
exactly. Yeah, yep.
So at Health Data Movers, we're more likely to be working with patients via the fact that we're installing platforms or merging data, which then is, it's on the provider side, the payer side, or biotech and digital health. And, our overall mission is empowering patients and providers by unleashing the potential of healthcare data and technology. How do you see that mission playing out at scale in the industry?
Well, I think what you just described will be a central big part of what continues to happen in the years and the decades to come. I mean, we spoke earlier about the critical role of having data, clear, clean, usable data,
Right.
and the data that's getting produced is constantly changing. And so the task, the role of doing what Health Data Movers does, in my judgment, will continue regardless of what EMR system is there. There's just this big challenge of aggregating data, moving it, cleaning it, making it ready for use. And I don't. That's one of the great things about Health Data Movers is you focus on that.
Right.
That's kind of what you do, and so you've built up a lot of expertise to do that really well, and we're happy about that.
Definitely appreciate that. I do want to talk, we've talked about the AI future. And so, if there's repetitiveness in this answer, that's also fine. But, maybe, outside of just technology, just in general in healthcare, what excites you the most and what should leaders be doing, or excites you most about the future, and what should leaders be doing the most to prepare for the future, understanding that you've talked about many different points throughout this conversation. So maybe
Right.
there's reiteration needed, but putting it out there
Yeah.
that.
I get motivated by thinking about and envisioning and working with others who share some of that vision. A world in which we can help people have healthier, more productive lives, basically. Having a world in which, especially younger people, uh, can understand the impact of their own decisions that they make and that they can choose and pursue healthier lifestyle. Healthy doesn't need to be, boring. It doesn't need to be, strict.
Right.
It can be great,
Right.
but you just want people to do that so that they can live long, healthy, productive lives. At some point, we're all going to die. We know
Right.
that, but
Yeah.
it would be great if people could live in a healthier state for
Sure.
more of their lives, and that they could live longer. I'm not one of those that has. It's interesting, but I'm not sort of focused on this whole realm of longevity and
Right.
living to be 110 or 20, something like that. I mean, there are people who focus on that, but I don't see that as being um, as important as just making the average person, helping the average person be healthier.
Sure.
And it's just, it's kind of like, how do you help create a better world? And that really was kind of what motivated me as a young man. Was I saw physicians in my community who were cared for me or members of my family, but they
Sure.
were also physicians who were involved in the community, either as a mayor or a county commissioner or head of the school board, or, they were engaged in the community and helping the
Right.
community. And that must have left. I can't figure out what it was. I think that was it. That must have left me with a very strong impression, that had a big impact for my future, because I didn't have a family member, a parent or grandparent or anything like that was interested in medicine. But I
Gotcha.
was kind of interested in the science part, and then when you combine that with the people part and the community part, it just seemed to make a lot of sense.
Wholly agree with you on the need for living our healthiest lives, in the present moment. I know that is a big, as a millennial, we are very concerned with being present. So obviously being the healthiest in the present is where we want to be. But I also, for like, most importantly, want to thank you for not just being on our quick hits, but also, the lifetime of service from being,
Oh,
a
thank you.
provider, a physician, and then, serving that in higher level capacities in our government, and now is an amazing chairman of CitiusTech. So yeah, thank you for all that you have been doing to forward the cause.
Well, I appreciate that. And I will note that on your point about, the longevity and the just helping the everyday person be healthier during their lives, they actually are not in conflict. I think, if you're living a healthier life for most of your life, as much of it as you can, you're probably going to live longer,
Right.
on average, your odds. And this is a statistical thing. If you really think about it, doesn't prevent the accident from happening, doesn't prevent the genetic disease from coming at you, but on average, you're going to have a whole lot healthier group of people, and they're going to live longer, and they're probably going to be happier. So all those things appeal to me. So thanks for the opportunity to share it, and thanks for all you and your team are doing for CitiusTech. We appreciate it.
No, our pleasure, and thanks so much, Dr. Winkenwerder. And we will look forward to checking back in 3 to 5 years on these projections. And otherwise, until we have you on Quick Hits again, thanks again.
Thank you.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on YouTube, Spotify, and Apple Podcasts. And don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.